Good afternoon, everyone. Welcome to the next module, Module 8. And the topic is working with physical disabilities. In our previous module, we discussed about physical disabilities and how we manage them at home, how we manage these disabilities at home. So now we are considering working with physical disabilities. So without wasting much time, we are moving quickly to the introduction. Now, this module will explore what a physical disability is. Now, previously we talked about developmental disability, to be specific, and now we are talking about what physical disability is. So here we'll begin by defining physical disability and discussing some of the causes of physical disabilities. Then we examine how a physical disability is different from a developmental disability and the special adaptations people with physical disabilities may need to make. We will also explore the impact of a physical disability on a person's life, taking a closer look at the special stressors a person with a physical disability may have. And finally, we'll discuss how the home health aides or the personal care aides can best work with a person with a physical disability. Let's start with the first point, which is what disability or physical disability is. Now, what is physical disability? From the look of the word physical, we know what disability is. At least we're able to explore more on it when we're talking about the developmental disability. So now, looking at it from the aspect of physical, we know that physical things are things that can be seen with naked eyes, things that are observable, things that are visible. Good. So now, what is physical disability? I say it's a disability that is what that impacts a person's ability to perform physical tasks or physical function. Physical tasks like maybe lifting objects, moving from one place to another. Unlike developmental disability, that we could have intellectual disability having to do with something from the mind. Now, physical disability is talking about functional disability, physical functional disability, inability to perform physical tasks, and said it may or may not be developmentally related. Although we know that when we are talking about developmental disability, we said something that it will also be physical. When we talk about cerebral palsy, having not been able to move your muscles due to the fact that something happened with the brain. Now, this is the type of mental illness that affected, or a developmental illness that affected what the physical motor movement. But now, so physical disability may be or may not be developmentally related. Like some developmental disabilities that we discussed in the module 6 may result in physical disabilities also. For example, cerebral palsy, it is a developmental disorder in which someone has a physical disability. Good. Now, they have difficulty with motor coordination and the use of their muscles. Other physical disabilities are a result of maybe diseases, accidents, or traumas, or injuries, and etc. So, considering these two words, developmental disability and physical disability, a physical disability can result can be as a result of developmental related issues, but developmentally related issues cannot be physically related. Like it is not vice versa. So people who has developmental disability may also have physical disability. The people who have physical disability may not necessarily have what developmental disabilities. This is an example of a physical disability, not being able to move, and the girl is on the wheelchair. So let's consider quickly the causes of physical disability. Unlike developmental disability that we relate it to what is either it is congenital, which is at birth, or it shall happen within the age of 0 to 18 and at most 20, 22. The mental disability occur within this range. Physical disability can occur to a child of any age, at both infant or adult. So it is an injury. So what is the cause now? So an injury-related disability is one that is caused from an accident, injury, or trauma. Now, physical disability can be caused by what? Injury-related occasions or scenarios like accident like a car crash, injury, maybe a bone fracture, that's an injury, or trauma, physical trauma, like maybe someone fell from height and hits the head on the ground or a part of the body on the ground. These are trauma. No trauma about we have psychological trauma and physical trauma. We are not concerned about the psychological trauma here. We are talking about the physical trauma. Like for example, a motor vehicle accident can result in a spinal cord injury and causes what? Parallegia. That's loss of what? The lower body or lower body functions of the legs. Or it can also cause loss of the ability to use both the upper and the lower limbs, which is called quadriplegia. Now, a person may also lose a limb due to an accident or as a result of a disease process. So we have so many disease processes that make someone lose a limb. We have cases like gout. Gout that an inflammation of a joint can, if it's if the disease could exclamate like it's goes worse, it may result in total loss of that particular leg, total loss of function. Then diseases that are progressive can become worse and can also result in what? A person's having a physical disability. For example, we have muscular dystrophy, which is a progressive muscular disease that is inherited and which may become obvious at birth or later in life. And this is a physical disorder, a disease condition resulting in what? In physical disability. The people with this muscular dystrophy they have what? A regular wasting away of their muscles and have difficulty with what? Physically moving due to muscle twitching, stiffness, or atrophy. That's called the wasting away of muscles. So we're able to understand the fact that some diseases can cause physical illness, trauma can cause physical illness, physical disability. I meant to say, trauma can cause it, injury can cause it. So this is an example of a pictorial explanation. The first one here, we have two cars crashing together. Now, the respective persons in each car may develop disabilities towards fractured bones, fractured hands, anywhere, even the vertebral column can get fractured or also injury. So musculoskeletal disorders such as arthritis can also make a person become disabled. Arthritis means what? Inflammation of the joint. Arthritis. When you hear the word itis, most words ending with itis usually means inflammation. So arthritis means inflammation of the joint. Inflammation of joints. So a person with arthritis have what? They have stiffness in the joint, they have pain, they have decreased mobility. And there are some cardinal signs of inflammation. There's always pain, there's always redness, there is hotness, there is loss of function, and there is heat. So that majorly taken from the cardinal points of inflammation, which is what? Loss of function. So the person loses function of that particular region. Now, arthritis usually occur in the main joints. So the person will lose mobility, not be able to move the leg. You have osteoarthritis, which is a common type of arthritis, which mainly affects the elderly people, and they occur where there is a degeneration of the joint, degeneration of the joint, and it can make walking or use of one's hand difficult, although it can occur in both in any of the joints of the body, hands or legs, but majorly it occurs mostly in the knee joint. So it can make walking or the use of what the hands become even more difficult. Now we're able to understand that there are two types of arthritis mainly. We have the normal arthritis, which is the osteoarthritis, and the rheumatoid arthritis. And we said the osteoarthritis can affect mainly adults, like the elderly, while rheumatoid arthritis can affect child of any age, and both can impact what mobility greatly. So this is a type of a physical disease or physical diseases, yeah, that can result in physical disabilities. So this is an example of causes of what physical disability we see: drowning, falling, the hands is broken, falling from stairs, thunder strike, falling on the ground, on the slippery floor, walking with. See, it is quite explanatory. So let's move to the next cause of physical disability. Now, disease that occurs suddenly and unexpectedly, such as cerebrovascular accident or stroke, cannot cause a physical disability. We know cerebrovascular accident is an accident when there is loss of oxygen or blood supply to the brain due to blockage or hemorrhage. Now, here they said a cerebrovascular accident is when the blood and oxygen supply. Now, the blood, and you can't separate both, because if there is lack of oxygen supply, it is definitely because there is low tissue perfusion, which means that the amount of blood, the blood carries oxygen, because we know that. So the amount of blood flowing to the brain, that is supplied to the brain, has been impacted, has been reduced, it has diminished due to what? Blocked arteries or hemorrhage in the brain. And some people who suffer from a stroke may become unable to use their hands or their feet, or dress or feed themselves, or even speak. The stroke, mostly it affects a complete side or even both of a person. So when someone has when the part of the right side of the brain is affected, it affects the left part of the body. And when the left part of the brain is affected, it affects the right part of the body. So the person loses what? Complete motor functions of the hands and the legs and every motor activity of that part that is affected. So the person may not be able to speak, may not be able to feed themselves because they can't use their hands, and may not be able to even move from one place to the other. So this is an example of stroke. We look at it vividly. Let me zoom in. Now we have the ischemic and hemorrhagic stroke. Now here, the ischemic stroke here is there is what? There is a blockage. The and this is the second one, hemorrhagic stroke. Hemorrhagic stroke here means what? There is a ruptured vessel, hemorrhagic from the word hemorrhage. So hemorrhage means loss of blood. So now, hemorrhagic stroke as a result of what? Loss of blood. So there's a rupture Sorry, I got logged out. I'm going to share my screen again. So continue from where we stopped. All right. Sorry for the bridge. I was locked out. So the consumer restore, we're talking about ischemic and hemorrhagic stroke. I was able to make us understand what ischemic stroke is and what hemorrhagic stroke is as a cause of physical disability. Moving next now, we'll be talking about the temporary versus permanent disabilities. Now, I would say type of disability. Now, there are two main types, or let's say the category, when we want to categorize them, there are two main categories of disability. We have the permanent disabilities and the temporary disability. Now, while many of these types of physical disabilities are permanent, there are also temporary disabilities. Now, what is permanent disability? From the word permanent, we mean that the person has it for the entire life. While temporary means the person only has it for a short period of time, and over time, the person will regain the ability to do what he has lost, and he goes back to what normal activities of daily living. So permanent disability is one a person will have for their entire lives, while a temporary disability is one a person will have for only a short period of time. Now, for example, this is a disability as here we have permanent disability. Let's start from the first one. An example: someone who is blind is a permanent disability. Cataract is temporary. Now, a distracted driver, well, here is situational because he has lost sight of the road, so we call them situational what? Situational. Now, looking at this one, someone who has a broken arm is a situational or disabled person. Someone who is holding a baby cannot use the hand. If you're holding a baby, you cannot use your hand to do other things at that time. So it's temporary. Then someone who lost an arm completely is permanent, cannot regain function of the hand again for life. Another example here is someone who cannot talk, who is non-verbal, is a permanent disability, who cannot speak. Someone who has laryngitis is temporary, maybe for a while. You understand? Then someone who has accent issues, they are situational. So these are just spectrums of what disability. So we can just check the pictures later. So a person who suffered a stroke may only lose the ability to physically function for a short period of time. With rehabilitation, the person may regain their full or near normal function and regain their go back to their daily activities of living. Another example of a temporary disability is or would be someone who has had a joint replacement surgery on their hip or on their knee. Now, after the surgery, for a period of time, the person cannot walk and gradually begins to learn to walk again and begins to walk normally over time. The person who has suffered a fracture or a broken limb, such as an arm or leg or pelvis, they also have physical disability, but these are temporary. Why? Over time, the bone is expected to heal up and the person begins to walk again. For the time being, he is actually disabled, but not permanently, because over time he will regain those functions back. So after the period of healing and rehabilitation, people with these types of physical disability may likely go on to or return to their normal or their near normal physical functioning. What are the unique attributes of physical disabilities? Unique attributes of physical disabilities. Before we move to these unique attributes of physical disabilities, we spoke about temporary versus permanent. So we've had examples of temporary. What about permanent disability? Permanent disabilities now, an example I will give is someone who lost an arm, who had amputation of the leg, maybe the lower leg, above the knee amputation or below the knee amputation. However, this person is categorized under the permanent disability because throughout their life, they can never regain that leg. Although science has improved that we could have artificial legs, but you can never you can't qualify or compare artificial leg with the real leg. So these kind of persons are categorized as permanent disability. People who lost their sight due to maybe trauma or accidents or the likes, they are permanently disabled because throughout the person's life, they cannot regain this function back. Now, let's look at the unique attributes of physical disabilities. A diagnosis of a physical disability is highly individual and unique, depending on the type and the cause of such physical disability. A person may be impacted in different ways. No two people with the same disability will necessarily have the same impairment of functioning. Now I come again. No two people, meaning that there are no two persons with the same type of physical disability that will necessarily have the same impairment of functioning. What do I mean? That two persons may have the same type of physical disability, but not the same type of impairment of functioning. You understand better as we move on. Now, while some people may have difficulties with performing the activities of daily living, such as dressing and toileting, other people may also be able to perform this task independently, but may be unable to walk or move normally. Now, let me use an example. For instance, two persons they are both on wheelchair. Now, two of them having the same physical disability, but one of them may be able to at least brush for themselves, wear clothes for themselves, and the only thing they cannot do is just to move for themselves, while the other person may not be able to perform any of these activities of daily living. So I hope you understand that. Now, a person with a physical disability may need to use adaptive equipment to help them get around, like adaptive equipment like the wheelchair, the walking sticks, and the likes. So some kinds of equipment a person with physical disability may use are the wheelchair, the walkers, and the cane. The walkers is what we call walking sticks. And cane. Now, for people who have lost a limb, they may have a prosthetic device, such as an arm or a leg. A prosthetic device is specially made and fitted at facial limb or body parts. And some people may use adaptive equipment such as the special shoes or the boots to help them move with mobility. People with vision or hearing disorder may use equipment such as glasses or hearing aids, or even walking things for the visually impaired, or even use of guide dogs. Now, the use of adaptive equipment such as the special plates, the cups, the eating and writing utensils, and special furniture and supplies can help a person with a physical disability or a physical impairment to be independent. Now, someone who cannot walk or has can make use of a walking stick will necessarily not need or will not depend on someone completely for locomotion. So other members of the home health care team, such as the physical other member or the physical therapist or the occupational therapist, can be very helpful in helping the patients and the home health aides or the personal care aides to learn about how to use special adaptive equipment. So it is our duty as home health aides and personal care aides to assist them in or to teach them how to use this special adaptive equipment. It is important to remember that every person is unique and will have different impairment of functioning as well as ability to adapt to their impairment. So we should also understand that as much as there are adaptive equipment for them, they may take different times to adapt to use those equipment. So as home health aid, we are to assist them and to help them as we understand that everyone is unique. So we have different impairment and functioning, and their ability to adapt is different. So we help them to adapt based on their abilities, not forcing them or making them feel dejected and the like. So let's look at the impact of a physical disability on the quality of life. What is the impact of a physical disability on the quality of life? The first thing here is the support system. Now, many people with physical disabilities are able to lead independent lives or to be fairly independent with additional support. Some may require some assistance with performing activities of daily living, while others may require extensive assistance. Some may require just a little assistance, while others may require what extensive assistance. Now, many people with disabilities are able to function just as a person without a physical impairment while making adjustments for their disability, while some who have temporary physical impairments may only need assistance for a short period of time while they are recovering. So having a support system can be very beneficial for a person with a physical disability because, like we've said so far, physical disability of different types and different categories and of different levels and grades. But one thing is important, support system. So having this support system can be very, very beneficial for a person with a physical disability. A support system is any person or a group of people who can assist or provide support in the form of emotional or physical, such as maybe assisting with completing tasks to a person who is physically disabled. So support systems can include families, can include friends, can include social support, such as people from work or from school, from church, or from other groups. Now, this is a pictorial representation of what the support system. So helping one another, upholding one another, especially those with physical disabilities. And this is also an example. So the first one we talked about is support system. The next one we are moving to now is stress and coping skills. As we know that it is kind of tedious or hard for those with physical disabilities to cope with their stressors. So every human being have stressors in their lives. So people who are physically disabled even have more stressors because why? They cannot perform those activities that an able-bodied person would have been able to perform independently. So they need to what? Depend on someone to perform this task for them. So as a result, they have what increased stress levels and they need to what learn how to cope. So they have trouble coping. So now every human being faces stressors in their life. So stressors are anything that can cause stress, anxiety, frustration, or even anger or depression. Most of us know the word stress. Even as a layman, you know what we mean by I am stressed out. It means you are tired. It can be you are frustrated. It means that you are anxious. It could mean a lot of things. So they can at times make us feel overwhelmed. Feel overwhelmed. You feel tired. You feel like the world is going to crush on you. You feel like the world will just swallow you up. You can't just open and you swallow the person up. The stressors will impact each of us in different ways. Now, impact us in different ways such as everybody have the way we react to stressors. People may some people only face quite a little amount or exposed to a little amount of stress, but the impact it has on them is so great that it affects almost all the aspects of their lives. While some people have a resistance towards the impact of stress. So stressors will impact each of us in different ways depending on our coping skills. Now, using positive coping skills are helpful when dealing with stressors because what are positive coping skills? So we don't start with positive coping skills are those skills that makes us less vulnerable to stress impact. So for home health aides or personal care aides, it is important to help your patients to express their feelings and thoughts and to help them use these positive coping skills. Now, this positive coping skills was discussed in module 5, which where we talk about the unhealthy and the healthy coping skills and also help the patients use their healthy coping skills to learn. You will see that literally when we face a lot of stressors and you you don't find how to manage them, you get even much more overwhelmed, no matter how little or great the stress may look like. So using healthy coping skills will help reduce what stress impact on both the able-bodied person, but more importantly, the physically disabled person. Still on stress and coping skills, in addition to many stressors people face in their everyday lives, a person with a physical disability may face special stressors due to their individual situation. I repeat, In addition to many stressors people face in their everyday lives, a person with a physical disability may face special stressors. Now, the word emphasis on special stressors due to their individual situations. We all do not have, let's say, people that are physically disabled don't all have the same disabilities. So, depending on their disability, they may have special stressors due to their what individual situation. So, they may not be able to work and support themselves financially due to their physical disability. They may be reliant on others to provide their care. For example, if they are unable to complete activities of daily living, they may require assistance or total care from another person. So imagine someone having to depend on another person. We've said this over and over and over again. It increases, it is even much more stressing and frustrating when you have to wait on someone totally for your care. So, so this person may lack the opportunity for socialization because why? Because of their physical disability. Now, socialization means that you are being able to interact with other people. In our world, like I love using that word in our world, in our contemporary age, segregation is one of the most common thing among able-bodied persons and the physically disabled person. We don't want to find anything to do with them. We believe they are outcasts or they are low living humans. So these people will not, they can't socialize. So because of the physical limitations, like not being able to engage in physical activities, the limitation placed on them due to the equipment, that maybe the wheelchair, they are on wheelchair, they cannot independently move around or get around in the community. So is this produces feelings of embarrassment. And for persons with a temporary disability, they may not be able to drive or get out of bed at this time. Of stress. Imagine you are used to moving out, walking about. For example, a footballer who had fracture and lost the ability to play football for the period of time. That is very, very stressful. Saying the fact that what he loves to do, he has lost the ability to do them and he sees others doing it. This leads to a feeling of stress. So physical limitations may also make sexual intimacy more difficult in that a person with a physical disability may need to make adjustments in order to engage in intimacy. Making adaptive changes in order to reach sexual intimacy needs can also cause a person's stress. So these are many things that can cause that can increase level of stress, inability to perform the normal physiological function of the body. Sexual intimacy is impaired, moving about is impaired, performing tasks for oneself is impaired. So all these things can increase what a person's stress. So such a person needs what a good and a healthy coping skills to be able to manage their stressors properly. Now, for a person who was not born with a physical disability, it often makes time to adjust and takes time to adjust to the emotional and physical challenges that their physical disability now poses on them. So the person may have different feelings about their situations, and they may feel frustrated or even angry that they can't perform tasks that they used to. Like I make an illustration of a footballer who played football very well and then had fracture and lost the ability to play football. And this man was not born with fracture, was not born with that disability, but he developed it. So it takes even more time for those that were born with it. They never experienced normalcy. They were never normal. So they never had the taste of how it feels like to walk around. But then you've tasted and you've enjoyed how to walk around. And all of a sudden something happened and physically they become disabled, they can't even around this function again. So it takes even more time for them to also be able to adjust. They may have they may feel frustrated or feel angry that they can't perform the task that they used to. And they even have anxiety about not being able to work and provide for their family while they are recuperating and while they are healing up, while healing process is taking up. So they can even become depressed, feel hopeless, even about their future. So this is a really, really stressful condition. The person who was born with a physical disability, they too may have varieties of emotions about their situation, although they were born with it. Of course, they do have emotional fluctuations, varieties of emotional situations, but you wouldn't compare them with those that were not born with it. Now, they may even go through periods of mixed or different emotions because it's mixed emotions. They're becoming depressed in a period of time, and again, they are okay, they are not happy. Well, they can't even define the emotions they feel. They can't really define what they feel. Families of the patients may also have all kinds of emotions as they deal with the physical care of the patients, the financial care, the financial burden, and the unanswered questions about the future. So it becomes more stressful even for the family of these persons to be able to cope with the stress. So as home health aides, it is important for us to know, and personal care aides, that to use communication skills and you spend enough time listening to them and the family's concerns. The first step in helping someone is to know what the person feels. So you hear them out, you let them express themselves to you. Good communication skills, not just communicating alone, good communication skills, because you could have bad communication skills. If you're a bad communicator, you would rather complicate the issue of the patient than even making you better. So we have to develop a good communication skills and spend time listening to them, that's the patients, and even their families' concerns. And if they ever have a concern that a person has developed a mental issue, you should inform your supervisor. If you're taking care of physically disabled person, and you discover that due to the physical disability, the mental state has been affected, you want to inform your supervisor immediately. So a patient may benefit from professional counseling or and additional support as they learn to cope with stressors and life challenges. So not having a strong support system or a positive coping skills can negatively impact how the person copes with. I'm sorry, I got locked out again. I'm about sharing my screen. We're almost done with the lecture. Sorry for the bridge and the all right. So let's continue from here. Not having a strong support system can affect not having a good support system or a positive coping skills can negatively impact how a person copes with their physical disabilities. So as home health aides, or personal care aides, we can make a positive impact on the patient's well-being by teaching them to use positive coping skills, listening to their concerns and feelings in an empathetic way, and their worries, by their frustrations and their concerns. If home health aides or personal care aides ever feel that the concerns of their patients or family are more than they can handle. Like if you ever feel that the concerns of your patients or the concerns of your family is more than you can handle, what do you do? Or if you feel like your patients will benefit from a professional counseling, please do not hesitate. Speak up, you will communicate with your supervisor, and you'll be told what to do. We have come to the end of the lecture. Thank you for your time. Just a brief recap because of the breaches in communication as intervals. So we talked about working with physical disabilities, and then we introduced ourselves to the topic. Then we talked about what physical disability is, and we talked about the causes of physical disabilities, accident, injury, and trauma, and other diseases that will cause physical disabilities. Then we talked about the temporary versus permanent disability, and we talked about that disability can be temporary or it can also be what is permanent. And we move quickly. We talked about the unique attributes of physical disabilities, and we talked about the impact of disability on the quality of life. We also talked about the support system, and we're able to understand different ways in which a person can cope, talking about the stress and the coping skills. Then, finally, we ended the class with the fact that not having a support system can impact a person's well-being and life because of the stresses they face. And the final conclusion is, as a home health aide, if ever you feel that your patient is undergoing a situation or it's not that you have concern that they are having to stress it that you cannot handle, or you feel like your patient will benefit from a professional counseling, please do not hesitate to do that. Thank you for your time. Enjoy the rest of your day.